£1 million or more of funding and ensure that it flows down to them if they're also under financial pressure at the moment. And I hope that that will help. Obviously, my department and I are here to speak with those councils and ensure that it flows down to them if they're also under financial pressure at the moment. I'll come to the second question now, which is from James Vincent from BBC Yorkshire. To speak to those councils and ensure that it flows down to them.
Thank you very much. On BBC Look North tonight, we've gone out to Sarah.
I'll come to the second question now, which is from James Vincent.
A kidney transplant. Her operation was cancelled when the coronavirus crisis hit. What works the government and the NHS doing to make sure that those people that need vital care, vital operations away from coronavirus are going to get that as soon as possible? And what's the NHS and the government doing to make sure that any backlog is worked through in the best possible way?
Thank you, James. And that's a very important question, which I'm sure is on the mind of many people across the country. Can I perhaps come to Nikki in the first instance?
Absolutely. Thank you for your question. And it's something that we're thinking about very actively, as you can imagine. I think it was right that over the last few weeks and months, the NHS made a concerted effort to focus on services that were either urgent for an individual or were related to the COVID response. And we absolutely had to do that. So we had to step away from other procedures and routine reviews that we might have otherwise done. But now, and as Sir Simon Stevens wrote last week, we've asked the whole system to start to think about how to get back to what we call normal services. And there will be some things that we want to keep. So during the pandemic, actually services have revolutionised the way that they've worked, whether that's by using digital technology or developing new ways of caring for patients. But in the case of the child that you mentioned, that child will be prioritised and that operation will be scheduled so that we can get people back on track and that the really important things happen as soon as possible.
Very good, thank you. Do you have a follow-up question, James?
Secretary of State, a quick follow-up on council finances.
We can get people back on track and that the really important things happen as soon as
gap
possible.
Between what you're providing and what they think they'll be spending on the coronavirus crisis. On Monday, you told on council MPs that some of those calculations
and that the really important things happen as soon as possible.
Between what you're providing and what they think they'll be spending.
No, not at all. We've provided, as I said, £3.2 billion to councils already, plus £4 billion of cash flow. It's a lot of money that we provided in just a 2-month period to councils. No, not at all. We've provided, as I said, to meet the immediate demands of the crisis already. However, as we understand better the length at which lockdown measures may have to be in place and the economic disruption that flows as a result of the crisis, which is difficult to judge today, we will work with councils to ensure that they have the funding that is required so they can navigate their way through this difficult period. So my message to councils is continue to do the important work that you're doing, whether that's on adult social care, getting rough sleepers off the street, supporting the vulnerable, getting those business grants out to the community, and we'll make sure that you have the funding that's required, and we'll work with you to better understand in the weeks and months ahead the true impact upon your finances of the disruption economically that we're suffering and of their response to coronavirus. It's too early to tell, in some cases, what those costs will be, but we will learn in the weeks and months to come, and we'll work very closely with councils, including throughout Yorkshire. Thank you. The next question is from Tom Sheldrick, who is from ITV Tyne Tees. Tom.
Thank you. Good afternoon. Last week, our analysis revealed that the North East has had a higher number of confirmed coronavirus cases per head than any other part of England, and the gap is continuing to widen. The virus is affecting some of the most deprived areas in our region particularly badly. The regional chair of the British Medical Association, Dr. George Ray, has called for the government to act on health inequalities, which he describes as a point of national shame. So what are you doing now to try to reduce the number of people in the North East being infected with coronavirus? And going forward, how will you address long-term issues, which mean that people in our region are less likely to be in good health and at greater risk from viruses like this?
Thank you, Tom. Well, I'll ask Yvonne to speak in a moment to the main part of your question. But on the broader issue of emerging data suggesting the socio-economic impact upon deaths with the virus. Obviously, that's extremely concerning to us. We want to understand all of the contributing factors that make people more vulnerable to the virus, including those, and including, for example, some of the ethnic groups like the BAME communities and their exposure to the virus. We're working with Public Health England and on some of those issues, like, for example, the BAME issue. The Chief Medical Officer has commissioned specific research so we can better understand the issue and respond to it in due course. But Yvonne, I don't know if you want to say more, in particular about the North East and its position in the passage of the virus.
Thank you, Secretary of State. So, Tom, there are over 8,000 confirmed positive cases of coronavirus in the North East at the moment. And as you say, some areas of great need, which, of course, we would have been involved with both from our national through to local services in the public health system before this epidemic. What we really need to know now first is to understand what additional or excess impact this virus has had on those communities and how distributed that might be. So as well as doing work on generally on disadvantage in particular groups in the population, and we will be able to describe that as we go forward over the coming weeks and months. But we also, I would want to reassure you that, you know, the business of as usual work needs to continue in working locally to promote the good health of people and to ensure that we are protecting their health from issues other than COVID. Because one of the great dangers here is that people forget that actually there are other harms in the population, some of which may be greater than the virus itself. So our local teams working with local councils and particularly local public health departments, directors of public health, are very active. We're in touch every week and sometimes several times a week to understand the dynamics of what is going on and to make sure that the good business as usual, as far as it can, continue. And just one concern is, of course, that where services have had to stop, for instance, immunisation or smoking cessation, that we actually move as soon as we can, when it's safe, to re-establish the preventive services as well.
Thank you. Tom, do you have a quick follow-up to that question, or are you content?
Yes, please. If I can ask you, Secretary of State, are you considering lifting lockdown restrictions later in regions like the North East, where the number of coronavirus cases continues to grow while it's perhaps stabilising elsewhere?
Well, the Prime Minister will set out on Sunday our approach to the next phase of the virus. So I don't think that I can helpfully presage those remarks. Our strong preference, though, is that the whole country moves as one. But if, as we build up our infrastructure for testing and tracking and tracing, in time it's required for us to make interventions in smaller sort of micro communities where you're seeing the virus take hold again, then that will be something that we consider, as other countries around the world have done when they've implemented effective track and trace systems. But that's quite different to making major changes to lockdown measures in one part of the country versus another. And our strong preference, as it was at the beginning of the lockdown measures, is for the whole country to move as one. I'll go now to the next question, which is from Zena Hawley from the Derby Telegraph. Zena.
Thank you, Mr. Jenrick. I wanted to say that Derby is a great city with a strong industrial base, but the announcement of 8,000 potential job losses at Rolls-Royce could have extreme consequences, obviously, for the company, but also for the supply chain of the companies that obviously supply it. What can the government do to help Rolls-Royce, a company that's always been there for Britain through times of extreme hardship, etc.? Well, and also, could I ask more widely, what role does the government expect cities like Derby to play as we emerge from the current crisis?
Well, thank you very much. And I share your concern for the news of potential job losses at Rolls-Royce. I know how important Rolls-Royce is to Derby, to the Midlands and to the whole country. It's one of our most important advanced manufacturing business, one with a very rich history, and I'm certain a business that will have a great future as well. It's renowned all over the world. Aviation is an important sector to the economy, but it is a sector facing almost unprecedented issues as a result of coronavirus. We want to support the aviation sector in any way that we can do. The Chancellor has already announced an unprecedented set of measures to support businesses large and small. I know that Rolls-Royce is a business that has already taken advantage, for example, of the job retention scheme, furloughing some of its employees from April. We're going to work closely with the sector, and we've said before that we're willing to consider situations where we would support individual firms, but obviously only when they've worked through the existing government schemes and other ways in which they might be able to raise finance commercially or through existing shareholders. If there's more we can do for Rolls-Royce, we want to do so, and I know that the Business Secretary and the Chancellor are already in contact with Rolls-Royce and will do so again in the future. As regards Derby, more generally, while it's one of our great cities, a city I know well representing Nottinghamshire constituency nearby, I'm certain it has a strong future. I will be working closely with local leaders to ensure that their plans for rebuilding and recovering the local economy work in step with those that we're producing nationally. And the voice of the business community in Derby is heard in the decisions that we're making here in Whitehall. And that's the same for cities, for local government leaders and for mayors across the country. Thank you very much. Was there a further question you'd like to add, or are you content with that?
If I could, please. I wanted to
Absolutely.
ask about education, because that is something that's dear to my heart as the education correspondent at the Derby Telegraph. Schools and their plans for reopening. I've had discussions with local unions, I've had discussions with local experts in the education field, and there is a strong feeling that it's going to be very, very difficult to achieve very easily. And I'm wondering whether or not there is going to be any move towards having PPE in schools at all. So far, teachers have been going into school, they've been there for key workers' children, they've carried on, and I know there's been quite a bit of illness among teachers. But I mean, what can we do to protect our teachers and actually give confidence to parents, staff, I know there's been quite a bit of illness could be going back to school among teachers.
Thank you. Well, I know that there will be concern from teachers, as indeed from parents, and the education sector is working closely with the trade unions and other representatives from education to plan a phased reopening of schools where teachers